overtime.
Let's go.
Okay, we are going to go ahead and call to order the subcommittee for Senate Study Bill 3193. This deals with taxation and regulation of alternative nicotine products and vapor products, and it also makes appropriations. This is the subcommittee under the Appropriations Committee, so I want to make sure that we focus on that area. There's no official fiscal note on the bill, but the early reports indicate this tax rate that's in the bill could bring in nearly $15 million in new revenue for the first year, $18 million in the second year. The bill creates a standing limited appropriation of $3 million to the Board of Regents, University of Iowa Stead Family Children's Hospital, for the purpose of conducting pediatric cancer research, clinical therapy access, and providing physician scientist leadership. I think many of us in the building have had the opportunity to meet some cancer families in the state who have been advocating heavily for this funding and the benefits that that could bring for Iowa families facing pediatric cancer to have the opportunity to participate in trials here in the state, and also for what that could bring in additional research funding into the state, as we've seen other states really multiply investments that they've made to make progress in cancer research. I'm going to pause there. I know we have a lot of folks in the room who want to weigh in. Any opening comments? Senator Reichman.
Yeah, I'll hold.
Okay, Senator Dotzler.
I'll wait also.
Okay, great. So we will go around the room, and please let us know who you are and if you're registered on the bill, how you're registered. And do we have any folks who would like to go first?
Good afternoon, Teresa Harms. I'm here representing Cafe at Iowa Can. We are registered opposed to the legislation as well. So we respectfully ask you to oppose it as written, and instead of pursue a more consistent, fiscally responsible approach to nicotine taxation. This bill, written by the industry, because that's what we were informed of, that you're attempting to regulate attempts to address vaping and alternative nicotine products, but it leaves cigarettes, the leading cause of cancer and the largest driver of healthcare costs, completely untouched. Today, we know that 80% of the industry's revenue comes from cigarette sales, and then these products are just the new gateway to addicting this younger generation and moving them to cigarettes. This bill applies a very small tax, just 5 cents per unit or milliliter, that is highly unlikely to change behavior or reduce it in any meaningful way. So I just want to share, and these are examples just so you can see that certainly this isn't targeted towards me, but probably my junior high child. So this is a pen that can disguise, it's a vape, excuse me, that is disguised as a pen. So you're welcome to take it. It's $25, and then the vape cartridges are separately. I share this one in particular. So it's an extra strong Zyn. So there's 18 milligrams per pouch in this product. That's bought locally here in Des Moines. So is this one. So there's 18 milligrams. So for your awareness, there's about 1 milligram per cigarette. So you get about 18 milligrams per nicotine in a cigarette, and there's 20 cigarettes in a pack of cigarettes. So you have generally about 20 milligrams in a pack of cigarettes that's consumed by somebody who's smoking. In here is 18 milligrams per pouch. This retails for $3.99. Based on the tax in this piece of legislation, you will pay 5 cents. 5 cents for the tax versus $1.36 on your traditional package of Marlboros. So those are also for your entertainment. And then the other one that I would just bring, because I think these are fascinating, are these vapor products that my 22-year-old is addicted to now. Is so they gamify. So you attach these to your phone. There's games, and then you actually get points for products and other types of things. And so you can get more free product. You can connect them to your phone, and then you get points for every vape, every puff that you take. So, more fun products for you to, take a look at. These are not cheap, but, the question for all of you would be, I think there's questionable language in the bill. If you look at these products and then how you say you're gonna tax the liquid in the vapes themselves, it's per milliliter, and that's, nicotine is per milligram. So I'm not sure that that's clear in the language. So, I just bring that to your attention. So, I just want you to think about making this 5 cents per container, and 5 cents per milliliter into comparison with like can redemption, right? We throw our cans away every day, and or you can't even buy a piece of gum for 5 cents anymore. Also bring into, so if we just took I did $10 million because that's what I was told that this was going to bring in. So if you did $10 million, that means every man, woman, and child in the state of Iowa would need to buy 66 products every year to get to that $10 million level. So I just don't think it's probably realistic at the revenue that potentially is generated. Even if you did 15% of adults who we think are potentially using these products, they would have to pay a total of about $22 in taxes on their products every year. So just recognizing that this 5 cents is pretty minimal. And so we would just ask for fairness and consistency. So Iowa already taxes other products, 50% of the wholesale cost. We would ask you to continue with that consistency. Maintain fiscal responsibility, and that should be a priority. We're spending billions, 1.5 in fact, on smoking-related healthcare costs in Iowa. We're asking for a stronger comprehensive policy to reduce long-term Medicaid spending. And then we should be focusing on limited government and effective policy here. And if you guys are going to take action on putting a tax in place on these products, which we support, but not a minimal tax that isn't going to make a difference, not only on usage rates, but on revenue generation, that actually works. Thank you.
Thank you. Thanks for bringing these. I'll let you grab them back. Okay, thank you. You want to go?
Sure can. Thank you, Madam Chair. Subcommittee members, Phil Jennery with Iowa for alternatives to smoking and tobacco. So we represent the shops. Currently monitoring the bill, but do have some concerns with the taxation part of it. Want to say to the revenue side, I requested. Our concern here is if the current policy is in place, the revenue that LSA is stating to be impacted is going to be very minimal because of the way that the 2024 law that the Iowa legislature passed. We're not able to sell products or as many products as we could. We have stores closing weekly, monthly, and so we would suggest we have language that would align Iowa with the federal PACT Act to create some actual good regulation, also with a tax in there as well. And so we would urge you to take that language to create some type of regulatory reform where we can actually have a good product here, have a good environment for these businesses while also getting rid of the bad actors who, even if they are fine, they shut down, wait for a little bit, have another person move with another LLC ready to go to open up. So the good actors pay those fines. Those are the folks that are in. So if this bill keeps going on, there's not going to be that funding for it because stores are closed.
Thank you. Let's continue around clockwise if folks want to speak.
Very well, I put you to talk for the rest of the bill. Appreciate additional revenue according to and then obviously
Davis Brown Law Firm represents Source International, share the mission of a smoke-free future. And appreciate the thoughtful consideration of how to tax for Russian products. With me, I have Paul Bear, with Philip Morris International.
Thank you. Paul Blair, Regional Director of External Affairs for Morris International. I just want to touch on 2 points. First, for the illicit products have been shown that we actually don't manufacture. We don't sell a single 18 milligrams in anywhere in the entire world, let alone in the United States. So that's counterfeit or illicit. Luxury test. We cannot turn that into law enforcement. Beyond that, we appreciate the conversation that's occurred over the last year about the appropriate level of taxation for reduced risk products. These are products in particular that have FDA authorization as appropriate for the protection of public health. The 4-year review process under the Biden administration authorized past year. So FDA has concluded these are products helping smokers, they're helping smokeless tobacco consumers, and even helping vapors make a transition to authorized products. And tax policy plays a role in that. The appropriate role of tax policy, either encouraging or discouraging behavior, very important to that. On one end of the spectrum, you've got combustible cigarettes, which cause significant amount of harm to consumers. And then you've got a risk spectrum where when you eliminate combustion, you create an opportunity for a consumer to take a transition. That's our objective in the United States. So we applaud the conversation that's occurred over the last year and appreciate the consideration of the state taxation generally. Thank you.
Hi, everyone. Jen Ferguson with the Iowa Board of Regents, University of Iowa Healthcare. We are noted in section 3 of the bill, 1 and 2. And so there is an appropriation allocated to the Board of Regents for use by University of Iowa Healthcare, said Family and Children's Hospital, for pediatric cancer and support of physician scientists. So I'm just here to say that we're registered as monitoring the bill, but if there are questions, this is language that we could implement, and it would become effective July 1 of 2027 as I read the bill.
28.
Mark Beltram on behalf of Fuel Iowa. We are registered undecided. I just wanted to chime in. The other illicit product was the Benjamin made in China, and it's a serious issue. We passed a vape registry bill a couple years ago that's been in court. So stores that are selling legitimate products are already at a competitive disadvantage. And we have to be mindful of that. So to the point that was made about revenue being generated, I know there isn't a fiscal note, but we'd be skeptical about that if it didn't address the topic of illicit and counterfeit products, which are prevalent. 2 of the props of my esteemed colleagues, and maybe more, are illicit. That's just a fact. It says made in People's Republic of China, designed in the United States. Thank you.
Dave Scott with Altria. We're registered undecided on the bill, primarily because, as you can imagine, it would be difficult for us to weigh in on the tax part of it. But on the methodology based on taxing by the milliliter rounds, we do support that as opposed to by price, where in fact then it's a race to the bottom, the cheapest product that would have any taxes. So we're undecided.
Jake Heisman with Reynolds America. I want to make quick comments. None of those are our products as well. We supported the vape registration a couple of years ago. It is in court with the Attorney General, and we believe we'll have a hearing here in summertime. We fully supported that bill going forward because, like we said, these knockoffs for our products make us look bad, and we would never make anything that would sell target to kids like that ever. So we don't sell any flavors like that. We only sell menthol and regular tobacco flavors. So also we are on the side of the bill as well, similar to my colleague Mr. Scott said. I'm looking at other states to go forward. Most states around our region have no tax or 5 milliliter tax per vape on there. The per milliliter approach ensures that states don't provide tax advantages to large companies kind of like out of state illegal Chinese ones. No tax on vape. South Dakota, North Dakota, and Missouri, 5 cents milliliters. Nebraska, Kansas, and Wisconsin right now. Similar states have no tax on nicotine products at all. South Dakota, North Dakota, Missouri, Kansas, and Wisconsin tax on pouches based on price is Minnesota and Illinois right now. So the and Nebraska, excuse me. So going forward, those are the ones that we were talking about, be compatible, touch the 6 states, we'll make sure we're competitive with other states. So thank you so much. Again, we're registered undecided, and I appreciate your work on the language.
Amy Campbell, I represent the Iowa Behavioral Health Association, which do tobacco prevention work as part of their services, and the Pediatric Nurse Practitioners and the Nurse Practitioner Society. All are registered undecided. Honestly, they're torn. They really like the fact that we're recognizing and establishing a policy that these vapes and nicotine alternatives exist, that the market has shifted away from cigarettes into these products. Some of that shift has become because of price. And so we know that youth are very sensitive to price, and that is our focus sorry, I'm about to sneeze. That is our focus, is trying to prevent people from ever starting it. These are not harmless products. They deliver toxic, sometimes levels of nicotine, and there's a huge concern within the youth community about use. So we're torn because we really want to see a tax that would actually shift behavior, and we don't think that this is. So that's why we're registered undecided. We really do feel that this is a step in the right direction, but it's a very small step in that direction, and we would like to see that pumped up. On behavioral health side as well, they would like to see some of those revenues generated go to prevention efforts. Thank you.
Hi, Dr. Carol Keener, Society Cancer Action Network. There are two parts to this bill, and I want to touch on both of them. First, we are very concerned with the tax language proposed in this bill. As was mentioned, the bill taxes vapor and nicotine products at 5 cents per package or per milliliter. This is really a negligible amount compared to the recommendations put forth by the public health community. Research shows that in order to change behavior, the tax needs to be substantial enough to impact price. So 5 cents per package or per milliliter, it's just not going to have that impact. In addition, we know that taxing these products by percentage of price is the easiest and most effective way to collect the tax. Taxing a milliliter of nicotine product is essentially, it gets pretty complicated the way that these products are made, and we're putting a lot of trust in the tobacco industry to provide that information to the state. Second, this bill is not a cancer prevention bill. We are very thankful for the appropriation, which I'll touch on in just a moment, but the tax itself will do nothing to reduce Iowa's cancer rate. We heard last week from the University of Iowa Health and Iowa Cancer Registry that Iowa has a high incidence of lung cancer and mortality. We are higher than the US, and we are higher than our Midwest neighbors. So we know that we are falling behind when it comes to tobacco control policy. And we do have solutions, but this just doesn't go far enough to really address Iowa's cancer rate. HSN and the Access Health Initiative, we've been working with Representative Barker on a comprehensive tax bill. That bill includes increasing the tax by $1.50 per pack, and then it would add a tax on e-cigarettes and nicotine pouches at a percentage of the wholesale price, which would be equivalent to the other tobacco products, which would be at 50% wholesale. And we do recommend moving that bill forward instead, so that we prove that Iowa experience about addressing our high cancer rate, and then also preventing the use of products. The other part of the bill appropriates $3 million toward pediatric cancer research at the University of Iowa. We are very supportive of this funding and thank legislators for prioritizing this important investment. We are particularly appreciative that the funding is allocated towards the University of Iowa Cancer Center, because they are an NCI designated cancer center. We know that this money will be used by researchers in the top of their field. So we do urge you to prioritize cancer research funding, either with a standalone bill or attaching it to a comprehensive tobacco tax bill that will together address Iowa's cancer crisis from prevention to treatment, and then also preventing you from starting to use these products.
Anyone else in the room? Okay, we'll move to online testimony. If you're interested to speak, please use the raise your hand function, and we'll be able to ask you to unmute. And Christina, we'll start with you.
Good afternoon. My name is Christina Hamilton. I'm the Director of Advocacy for the American Lung Association in Iowa. We are registered opposed to this legislation. One of the reasons we're opposed is the taxes are based on volume and weight for alternative nicotine products and e-cigarettes. Tobacco companies favor these types of taxes based on volume to keep the price of their products cheaper for consumers. We have evidence that taxing tobacco products by volume is administratively complex. It requires independent verification of the quantity of taxable contents as well. So we are opposed to that provision, using the tax rate based on milliliters and weight for that reason. We also, as my colleagues have shared, would want to see a higher tax rate so that we can actually see a public health benefit from the increased cost on these products. We'd also like to see some of the funding go towards proven effective tobacco cessation and prevention programs. The state's tobacco control program has been underfunded for years, and we need more investment in services to help people addicted to tobacco products quit. We know that they want to quit, so we need more resources for Quitline Iowa. We need more funding for prevention programs that we know work, like Iowa Students for Tobacco Education and Prevention, a peer-to-peer program where young people educate each other about the harms of tobacco and help us prevent the next generation from being addicted to these products. And there are several other evidence-based programs that the Iowa Department of Health and Human Services leads with community partners. So we would like to see some of the revenue from this tax go to those programs that we know are effective. And I also want to remind committee members that, Philip Morris and Reynolds American have been convicted of racketeering for lying to the public about the dangers of secondhand smoke and smoking. So just want to be mindful of that as we consider legislation related to tobacco products. Thank you.
Thank you. Anyone else online who would like to speak to this bill, please use the raise hand function. Okay. Do my colleagues have any questions for folks who shared? Yeah.
Well, a couple, first of all, I saw one of those packs there that from Halo, and it said 4 joyful games. And I hear that this is illegal China products. Why are they available for sale here in Iowa? Do we have any enforcement? I mean, where's this stuff coming from, and why is it being allowed to be sold? Anybody?
Senator, in 24, we did pass legislation that required these other products that have not gone through FDA approval to be on a directory published by Department of Revenue. And the other side has tied that up in court cases. So these products are still out there available. And that legislation you passed in 24 did give authority at the local level to go in. So it isn't just the Department of Revenue doing its stuff.
That goes like my colleague, 98, 97, can't remember the year, we passed a registration for smokeless tobacco and cigarettes, so everybody knows what's legal, what's not. It's worked well for the last 20-something years. So now we did vape 2 years ago, and right now we believe July-ish, Attorney General believes we should hear a ruling back from that one.
Well, full disclosure, the first vape bill I was on and I supported it. And I had plenty of people say that they were going to market to youth. But I also know people who were trying to quit smoking, and they were actually being able to use these vape pens to get them off. In fact, I've got a friend right now that is using vape pens to get off smoking. But what I'm hearing is that she's using them more and taking in more nicotine than she did with the cigarettes, but she didn't have the effect on her lungs. Also, I know one of the things that I worked on the second bill and did my full disclosure, why I've changed my opinion on this is really it is being marketed to youth. We're seeing it everywhere, and it was a huge increase in youth, in high schools, in locker rooms and all over utilizing these. So clearly, we do have a problem. We still got a problem. Also, I like the concept of the bill trying to tax and increase it, but it's very clear to me that this is totally insignificant tax. I mean, it doesn't mean anything to a purchaser. And like was said, people are throwing away their nickel cans like crazy, just because they don't want to deal with it. So I've got a concern about that. I do like what's attempted in the bill, and I don't know if it's bait for legislators to finally we got some more money going to good programs. And I'd really like to see us taxing at a closer level to what a package of cigarettes is if you're going to be able to really make some impact on getting people off of the smoking and off of nicotine altogether. And I do know that nicotine is even more addicting than cocaine. It's one of the most addicting substances there is. So, I like the concept of the bill, but at this point in time, I think we needed to have some more work on a reasonable amount of taxation in it. And I've got some other concerns. I did hear that the milliliter is hard to know for sure how many milliliters you're really getting, and it's going to be hard to track. I don't know how else you would do it, but I definitely have some concerns. I think this bill's a plus, but we still need work to do on it before I'm willing to sign on. So I'm going to wait, and hopefully we can get some amendments to really correct some of these issues.
Thanks, Senator Dotzler.
So with me, and so you're saying that these games are already illegal,
I
those?
believe there is law. They've been
Okay,
this law
all
in
right.
FDA for a very long time.
That would-
But it not be enforced. And that's why we had a vape registration 2 years ago. We passed it. You all, Senator Reich, you voted for it. So it's, I've only had 3 no votes, I believe. And everybody voted for it. So we have an enforcement mechanism. So the AG and local law enforcement can actually go in the stores, and also our retailer partners with Fuel Iowa and everybody else to say, okay, here's the list. And so they know. It makes it easier for the retailers, makes it easier for everybody involved.
I mean, I grew up with my dad collecting Marlboro miles, but this is just sickening that they incentivize you, with a game to increase your usage. So, yeah, it'd be nice if we can address that or increase penalties or something. Thank you for sharing with me earlier that we are looking at, I think 75% of the opposition I feel like I heard was against the tax amount, and you're already looking at addressing that, and I'm sure you'll talk about that. So that was about 75% of the opposition to it, and with that proportionally, because the amount is in code, maybe looking at the amount that is going to the cancer research, and to include not just for pediatric, but of course we're talking about lung cancer here. So with that proportional increase, maybe also shifting some of that to lung cancer, which was, like you said, we're pretty high in lung cancer, and having a bad alternative or bad outcome to those being terminal. So those are the couple of things that I'd like to see addressed. But thank you.
Okay, thank you. So Senator Dotzler, I agree with you that a lot of these things started as smoking cessation, but now we see young people vaping and using these pouches at really high rates. I have 2 teenage daughters, talk to lots of teenagers. They all know where people are doing this in the school, who the folks are, and it really is a problem that can create gaps in brain development for young people who are using nicotine. I also think that that's why I like the tie to the pediatric research, even though those wouldn't be cancer cases that came from these things. I see so much harm coming to young people from vaping. There were doctors who sat in this room and spoke to me about doing a lung transplant on a teenager because she had vaped away her lungs and needed a full lung transplant. So there's obviously more than smoking cessation happening with these products. And I do think it's time that Iowa do what we can to address this. I share the concern with the nickel and also just the concept. I understand the concern of flat amount versus percentage and not wanting to be in a race to the bottom. And yet inflation is a reality that happens over time. So if we set a flat amount now, that's going to have a decreasing impact over time and a decreasing funding source for these important things that we want to do, both in the healthcare costs that come to taxpayers in Iowa and Medicaid and elsewhere from the impacts of tobacco, and in these research programs that we want to fund. So as I looked at surrounding states, I do see percentage of wholesale. I don't want to copy Minnesota at 95%, but as I see surrounding states with Illinois at 45, Nebraska at 20, and Kansas and Missouri both actively looking at 10%, all of those would have a significantly, larger revenue source for us and potentially a larger impact on young people who are using these. So I think we need to continue to have this discussion. I understand there are a lot of folks who wanted to look at cigarettes. I'm not willing to throw out the whole thing on whether or not cigarettes are included, because I think this is the growing and emerging area, and this is what young people are doing. And I, as many of you watched very publicly, was disappointed to see us not keep an avenue moving forward in that area. But I still think these nicotine pouches and vapes are a real issue for young people, and I want us to do something about it. So I'd like to move this forward and continue the conversation. Thank you, Senator Reichman, for signing on as well. And please continue to pass along to us the information that you have that can help us make the best decisions. Thank you.